First of all, this regional medical center is not just about healthcare, but it really is about healthcare, and it's also about economic development. Our expectation is that when we construct this new facility, not only will we change the face of healthcare here in Prince George's County, but we'll also create an economic development engine by creating jobs, by bringing research facilities here, by bringing additional medical practices, and all those types of ancillary businesses that operate in a healthcare environment. This process all started in 2011 with the signing of a memorandum of understanding between the University of Maryland Medical System, who, by the way, that we refer to as a private nonprofit and not a state agency. Also, Dimensions Healthcare System, the current operator of the hospital system, our state government, and particularly our Department of Mental Health and Hygiene, and the governor and lieutenant governor have been very, very supportive of this process. And also in the county government, the executive branch, the county executive signed an MOU along with the chair of our county council. So it really has been a team effort. The idea is, again, to revamp healthcare delivery in the county. One of the reasons that our current hospital system has been challenged is it's faced with outdated facilities, and for a number of different reasons, the operator of the hospital, Dimensions, has been financially strained. And a lot of that is due to an influx of uninsured patients or Medicaid patients. And Medicaid isn't a bad thing, but the reimbursements, particularly for doctors' fees, are lower than what it is for private insurance and Medicare for that matter. So what that has caused both the state and the county government to do is to provide an annual subsidy to Dimensions in order to cover some of those costs. So the idea about the regional medical center is to eliminate that subsidy and make the system a thriving system, be financially sustainable, and also deliver high-quality health care. Prior to signing the MOU, the University of Maryland Medical System took a look at the system. They did a study. That study was conducted with the help of KPMG, so they did have some high-level professionals besides themselves that were involved in that. And the idea was that one of the things they determined is that 32,000 people leave the state of Maryland every year to be admitted in hospitals, predominantly in the District of Columbia. Of those 32,000 patients, 25,000 of them leave from Prince George's County. So we have a real drain on hospital admissions leaving the county. Roughly speaking, of those 25,000 people that leave the county, if we had 5,000 of them that were recaptured back in the county, it would break our hospital system even. But it was determined that because of some negative perceptions that had developed over the years and other things, that we really needed to rebrand the system and build this new regional medical center. The other thing is the regional medical center would not be a community hospital just serving the community, but it would serve the entire county as well as the southern part of the state of Maryland. And the idea would also be that a lot of the high-end, complex tertiary care medical procedures that leave the county and go to the district or to the University of Maryland Medical Center in Baltimore or Johns Hopkins for that matter would be able to stay here in the county, and that bringing that high-end kind of health care back to the county and recapturing those patients would eliminate the need for the subsidy. So far, we've made significant progress along this road of the regional medical center. The county has secured and identified our funding, which I'll be honest with you, has always been the big question mark. People always ask the question, well, where's the county going to get the money from? The county has the money. Okay, so also it has been proposed in the governor's capital budget for 2014. The money's been put into the capital budget, so you want to make sure that you make your voices heard with your elected officials to make sure that that money stays in the budget, and that will allow the county to cover a third of the costs along with the state covering a third of the cost, and the rest of it would be covered by the system. And when we say the system, the hospital would be built and owned by what we're calling new Dimensions, and so some type of rebranded Dimensions. That rebranding has already started because the University of Maryland Medical System is involved with them now. They've taken over the operation of our 3 emergency rooms at Laurel, Bowie, and the Prince George's Center in Cheverly. The chief medical officer at the hospital, who works for Mr. Moore, who you'll meet in a minute. Carnell Cooper is a trained trauma surgeon. There is a John Spearman, who is the president at Laurel Hospital and is here somewhere now, is trained as well. And when you talk about the University of Maryland Medical System, you're talking about one of the best in the country. They have a shock trauma center there, which, as explained to me, that's not an emergency room, that's a MASH unit. But and it is widely believed to be the #1 shock trauma center in the entire world, definitely here in the United States. So we are really looking to partner with an expert in the healthcare arena. I mentioned that the hospital would be built and owned by New Dimensions that would become a part of the University of Maryland Medical System umbrella. Is kind of like the parent, and they have a number of 501c3s similar to Dimensions that operate hospitals within their system. A few more things before I introduce my colleagues on the panel. I talked about economic development. So we're not just talking about healthcare, but we're talking about a facility that would generate almost $337 million in construction and equipment purchases during the development of the facility, and which would amount to $578 million in economic activity in Maryland. And economic activity creates taxes, so you don't have to raise taxes, but you get more dollars coming in. The construction of the new facility would create over 4,300 jobs. Compared to the current facility, a new regional medical center will result in $100 million in additional revenue over what's being generated already, and $170 million more in economic activity here in the state. New facility would employ 300 more workers than the current facility, while supporting the generation of an additional 800 jobs through secondary economic impacts. And lastly, on the numbers, the new facility would generate an additional $76 million in revenue solely from residents who currently seek care outside of the county, and would be bringing their health care back into the county through admissions to the hospital. In terms of what we're doing to improve overall health in the county, and one of the reasons why I recognize Ms. Creekmer is our health department is working very hard to do a number of things. We were recently selected as a health enterprise zone here in the county, which will provide additional resources to bring primary care physicians into the county. We had a public health impact study that was done along with the University of Maryland College Park during the past year, and one of the things it identified is that we have a shortage of 61 primary care physicians here in the county. So the health enterprise zone will go towards attracting physicians to reduce that shortage. Also, our health department has implemented a local health plan. We were the first health department in the state to submit our health plan, and it is focusing on chronic diseases, cancer, hypertension, diabetes, asthma, and the like, and reducing those things along with sexually transmitted diseases, and also creating healthier environments here in the county to contribute to an improved health status. And then I can't help but to mention healthcare access. We have been involved in the opening of new federally qualified health centers here in the county, and are currently supporting Dimensions in opening a primary care facility over at the part of the plan that came out of the public health study. Can you hear me? Okay. Tell you what. How about that? Okay. What else would I like to tell you? I think I've told you a lot. Well, the thing I didn't tell you is that the hospital is estimated at this point to cost $645 million. Again, I mentioned that $200 million from the county, from the state, and the additional cost would be borne by the system, which will become part of the University of Maryland medical system. If you're thinking about finances also, I should mention that while the county is currently providing $15 million a year, as I said, as a subsidy to the hospital, as we issue bonds for our $200 million, the debt service on those bonds is about $15 million. So all we're really doing is redirecting money that we're currently paying as a subsidy to the system to really build this new regional medical center. In terms of the other benefits here to the county, I mentioned the need or the ability for you to and your family members and what have you to not have to travel outside of the county to, you know, have open heart surgery, although you don't have to travel outside for that now because they do that at Dimensions, but there are other high-end procedures that you get referred to the Washington Hospital Center or to University of Maryland Medical Center in Baltimore that you'll be able to stay here in the county and receive. And then also I mentioned attracting additional health care professionals, and there's a serious shortage of doctors and physicians that are projected nationwide over the next 10 to 20 years to have additional reasons for them to be educated here at the University of Maryland, which is one of the best medical schools in the country, but also to stay here to do their residency, start practices, and take care of those of us who are in need. So hopefully that kind of frames what will happen here tonight, answers some of your questions. What I'd like to do now is introduce Mr. Neil Moore, who is the Chief Executive Officer of Dimensions and is doing a fine job in improving the financial condition there, and there have been significant improvements, and has been a great leader for the system.
Good evening. Brad, thanks for the introduction. It is my honor to be here this evening with you all at this very, very important occasion in identifying the site location for the new Regional Medical Center, to hear your perspective on the site selection for the new Regional Medical Center. On behalf of Dimensions Healthcare System, we do have several employees here and executives here from the system, along with the Board of Directors of Dimensions Healthcare System. We welcome you here this evening. As Mr. Seaman pointed out, we have been working very closely with the University of Maryland and focusing in several key areas which will transition us into the new Regional Medical Center. Two key areas that we have been focusing on is clinical development. He's pointed out the emergency room physicians that are all three facilities from the University of Maryland. We have recently developed a very robust plan to redevelop our cardiac program. We have also established services with the University of Maryland on orthopedic services, and we continue to work collaboratively to improve the overall clinical development of the system. We are also focusing our services on our operational efficiencies. As Mr. Seaman pointed out, what's very, very important to the organization is that we become as efficient as possible. So we have been focusing our attention on those areas that would generate additional revenues for our system, as well as make us much more efficiently from a cost standpoint. As I mentioned, I will be very brief, and once again, want to welcome you, and I look forward to hearing your perspective on the selection of the site location. Thank you.